right. Natanya, you should be able to share as well now. So when it's your turn. All right. So what are we going to talk about tonight? All kinds of things related to mindfulness and meditation. And Natanya and I had a tough time really kind of narrowing this down. So we want to make sure we leave some time at the end. So really it addresses all of your needs and questions. But we're going to, review a little bit of migraine, what a treatment plan looks like, kind of define a little bit the difference between mindfulness and meditation, maybe cover some myths and misconceptions and where this fits into a treatment plan. And then really we want, participants to come away with some helpful tools that you can integrate into your daily life, whether you're somebody who lives with migraine, has a family member or a loved one with migraine, it can be relevant to all. Okay, so I know this seems probably redundant, but what is migraine? There's so many misconceptions, I think, that are out there that it's nice to touch on it. So this is a neurological disease. I think it's important to call it that. It gives it, the validity that it deserves. A lot of people struggle with stigma and misconception around migraine. So we need to recognize this and use the right language. It is largely an inherited or genetically influenced disease. So many of you may have had a parent with migraine or a child with migraine. Some of the ways that I describe this is that individuals with with migraine and this migraine brain have this increased state of almost responsiveness or hyperexcitability that goes on with their brain. And when you think about, getting to that threshold where you may be triggered into an attack, somebody else could be exposed to all of the same things, and that wouldn't happen for them if they don't have migraine. So the brain really behaves in a different way than those who do not have migraine. Amplification of sensory stimuli, so light and visual input, auditory, smell, these things can become very, very pronounced and often overwhelming. Ultimately, there are a whole spectrum of symptoms. We'll touch on this a little bit, and neurological disturbances. So it is not just a headache, and can be quite different for everyone. And even for each individual, they may have different days with different symptom types. Migraine is also very common. So we know that prevalence globally is sometimes kind of estimated around 12%. It's certainly over 10% in Canada. It does disproportionately affect genetically born females, so about 25 to 26%. And children also experience migraine. So sometimes this seems surprising to people, but about 10% of children, and it really can impact people throughout their whole life. I myself live with migraine as well, and certainly can't really remember a time that I didn't have symptoms. Now, it's always nice to kind of put it relative to other things. So when you look at migraine relative to some of these other things that I think we all would agree are commonly discussed and often, get a lot of attention paid towards treatments and management, but it really exceeds things like diabetes, asthma, low back pain. So it's very prevalent, and unfortunately there's still a lot of improvement that we need to do in terms of managing it well. So migraine is not just a headache. I think probably anyone that's here knows that and wants to shake their head when anybody says that. It's certainly not caused by poor self-care, and this is, I think, something Natanya and I talk a lot about, Wendy as well, that there is this pervasive misconception there. It is not cured by hydration. You can't just drink a glass of water, or it's not caused because you're not drinking enough, stress reduction, or medication. So we're not curing migraine. Our aim is to really live as well as we can and have the best quality of life and as little interruption to our function. It's certainly not a representation of somebody's strength or ability to cope. And it's not the same for everyone. So there can be fluctuations in frequency and severity and the whole constellation of symptoms, which I think can also make it very hard and isolating, because somebody may have migraine, but it could have very little impact on their life. And they may have that bias towards somebody who lives with chronic migraine and has other impacts. So it does make it a little bit challenging. Impact and disability. So I have a very strong interest in, work focused on advocacy and reducing stigma, and recognizing the impact of migraine, and ultimately trying to improve access to good care for individuals with migraine. Some of these statistics here that are quite, I think, sad when you see them, but are the result of some large studies, some done US population based and internationally. But 50% of individuals reported reduced family participation or enjoyment in the last month. And in this particular group, 75% said this was the case in chronic migraine. 39% of individuals with migraine canceled entertainment with friends, families, or colleagues. 50% felt they would be a better spouse if they didn't have migraine. And sadly, 12% of spouses also felt that, they would be have a better spouse if they didn't have migraine. 43% thought they would be better parents if they didn't have migraine. So these things are really, I think, a testament to what it is like to live with migraine and how it can impact your life. We do have stats that talk about how impactful it is, and it's recognized as the second leading cause of years lived with disability across all ages and genders globally, and it's actually the number one cause of years lived with disability amongst females age 18 to 49. And this really represents how many days accumulated over, somebody's life, or in this span is somebody impacted by migraine symptoms. And because it's often beginning in childhood, this is a profound impact. So we really, need to do a little bit better at helping to support migraine care. So I talked a bit about the stigmatization. It's very hard that migraine is invisible. So this pervasive bias that it's because of poor self-care, I think gets perpetuated by people around. Maybe it's coworkers, family members, healthcare providers that can suggest this, and that really gets internalized in somebody with migraine. It's not well diagnosed, so we really don't do a great job of calling migraine migraine. Sometimes it's tension type headache, sinus headache, hormonal headache. It doesn't really get called that, so you really don't get proper treatment. And as a result, it's not recognized as this incurable neurological disease that does have treatment options. If investigations are normal, it's sort of being dismissed as being insignificant to health. So, your MRI is normal, you're fine. And as a result, and I think Natanya and I talk about this all the time, there are a lot of things that can be done to help people manage migraine, live well with migraine, but really comprehensive treatment plans are just not always developed. So people end up living for a very long time without access to, evidence-based and good quality comprehensive care. Okay, so another kind of slide that I really like, and then I promise we will get to the mindfulness stuff, but I think that this is really impactful, and it will be relevant when we talk about mindfulness and how it can kind of help you maybe be a little bit more in tune to what's going on with your body. But if you take a look at, I know this very, very wordy chart here, this is kind of a textbook version of migraine attack. So it consists of several parts. So there's this prodrome phase. This comes on before the migraine attack. And sometimes people will say, I have cravings. I feel a bit irritable. I yawn. Sometimes your neck starts to hurt. You feel a little bit more increased sensitivity to, the kid screaming or the bright light. And if you're somebody like Natanya who has an aura, you may experience this, for a period of time before what we kind of refer to as the headache phase, although I don't love that term, the migraine attack. So then there's the postdrome. So a lot of attention gets paid to this period of time during which, the symptoms tend to be most severe for a migraine attack. But there can be days leading up to this and also days afterwards with this whole constellation of symptoms. And when you see, it really isn't just this head pain piece. Now, I kind of put this together because this is actually a little bit more what my patients tend to live with, and what certainly people with chronic migraine live with. So it's this fluctuating course where, sometimes people have no days where they're completely crystal clear, symptom free, and then it escalates into much more severe symptoms, and then it might kind of quiet down again. So there is a lot going on, and sometimes kind of constantly for people with migraine. So this really is not appreciated. And, you know, if this part is invisible, then all of these other things are even more invisible, if that's possible. And it can be a really, really difficult journey to endure this in isolation with people really not understanding. Where are the gaps in migraine care? How much time do we have, Wendy? um, so it is invisible. It is historically very stigmatized, and I think that gets really kind of ingrained in people living with it. There is no clinical diagnosis. There are lots of things that don't have a specific test, but somehow, you know, in the kind of clinical world, if there is an objective evaluation, you can measure a blood pressure, you can measure a blood sugar, but it's challenging with migraine because there isn't a test that says migraine. We know statistically it often gets misdiagnosed. There's not great access to, you know, the most current pharmacological treatments. There are a lot of new treatments that have come out in the last 10 years, but it's sometimes challenging to find a specialized provider that's well versed in this. We know that there's a lack of primary care providers. So aside from even specialists, you can't get to them if you don't have a primary care provider. So on the medical management side of things, we know that there are a lot of gaps. So what happens, individuals with migraine are really left to navigate on their own. So resources like Migraine Canada and these kinds of things are helpful, but you really need somebody to kind of spearhead that. So we're boiling this down to the mindfulness stuff. So what is a proper treatment plan? It really takes a multi-pronged approach. And I think for many people that have been on this journey, they've probably been dispensed advice at different times, you know, maybe uh, welcomed or unsolicited about like, have you tried drinking water? And have you tried doing this? And you should probably meditate. And sometimes these things can be very dismissive and undermine the journey. So you need lots of sort of tools in your toolkit and a lot of different strategies to tackle different things. So this is something that this sort of represents you know, in my mind, and also when I'm wearing my healthcare provider hat to patients, we need something in each of these areas. Mindfulness and meditation are tools. They're not tools that we suggest because somebody can't control their stress or they're not coping well. You still need other strategies to prevent and as well as treat an attack during it. So what we'll talk about tonight, these mindfulness and meditation strategies will sort of fall under this category of your lifestyle and behavioral strategies. All right, I'm going to turn it over to Natanya, and you should be able to advance the slides, Natanya.
Yes, yay. All right, so thanks, Christy. So I'm going to start with just a little definition because I think there's a lot of mystery around mindfulness and meditation and what they are and how they're different. So there are lots of definitions of mindfulness, but I think this is a really nice one in terms of managing pain and chronic pain and people, you know, who are looking at mindfulness really from a health care perspective. So mindfulness is the awareness that arises when we pay attention with intention and without judgment to what is happening in the present moment. This includes events happening externally in our world and internally within us. It encourages non-judgmental awareness and acceptance towards thoughts, emotions, and physical sensations. So in a nutshell, it's really about being in the present moment, being aware of what's happening, and not placing a value on that. Not, this is great, this is bad, it just is. And really in a nutshell, that's what mindfulness is. Okay, so I thought we could start by just doing a really brief, quick mindfulness activity. So I'm just going to get my stopwatch. So I want everyone to, if you want, to breathe in and out slowly. Just take a breath, a comfortable breath. And then for your first minute, I want you to explore, how am I doing right now? whilst focusing on your feelings, your thoughts, any sensations that you feel throughout your body. You can have your eyes open or closed. There's no requirement. And just keep your body comfortable. You can give each word or phrase a description to each feeling or thought. Just how am I doing right now? No judgment, just is. And then for the second minute, keep your awareness on your breath. Just focus on your breath. And if that's difficult for you, feel free to focus on something else. Maybe the tip of your finger or where your thighs are touching the chair. Just keep your awareness on that point of focus. No judgment, just noticing how it feels, focusing on it. If your thoughts wander off, that's okay. Just bring back to your point of focus. And then for the last minute, for your third minute, expand your attention outward from your point of focus, whether it's your breath or a part of your body, to feeling the ways your breath affects the rest of your body. What's the impact of that? Again, it's not right, it's not wrong. Just noticing. And then bringing your attention back to the webinar, opening your eyes if they were closed, and welcome back. And that is a very simple mindfulness activity. No judgment, just being in the moment, noticing yourself, noticing your feelings and thoughts, noticing what's happening around you and how what's affecting your body, and then noticing what's happening on the outside as well. And these tools you can use throughout your busy day.
Natanya,
Yeah.
go on. Did you want to give a little context to our selection for a picture here when we were talking about this?
Yeah. So we recognize that most of us are very busy. We have a crazy life happening around us that we still need to participate in, and we still, we might have a million things to do. And, there's images of a young mum with her kids, who are helping her with her laundry. And really it's about being able to bring these mindfulness activities to your present moment, to your day-to-day life. It's not something that needs to be practiced separately, that you need to set aside a whole heap of time for. And in fact, for this woman, she could really just concentrate on that laundry and on how the actions of the laundry and how it feels in her hands and what the smells are. And that's a mindful activity that's bringing her into the present moment, right here, right now. So it's something you can just easily incorporate into your day? Um,
There was when we were talking about this, Natanya, too, one of the things that we discussed in preparing this was sometimes the misconceptions that go along, and Natanya is going to talk about them. But one mindful activity that was sort of shared with me and I found very helpful, particularly it was introduced to me at a time when I had my kids were, well, they're still pretty small, but very small and needing to be even in my arms most of the time, and even going through sort of your five senses. So while you're doing tasks like picking up toys, folding laundry, chopping up snacks, what are you hearing right now, and trying to kind of tune into, what a sound is in the room. And you can almost reduce down to like a bird outside, and maybe a car going by, and then what are you smelling? What are the, of something that you're cutting, or the fresh laundry? How does it feel? What is a tactile sensation? And going through those, and I found it very, very grounding. It didn't have to stop me doing whatever I was doing, but it did help redirect maybe some of those racing thoughts that can kind of bounce around, especially when you're maybe feeling overwhelmed that you can't get to some of the things you need to and you're preoccupied with other things. So that can be applied as well in scenarios and situations where you're maybe being exposed to things that are starting to escalate some of those symptoms that go along with migraine, or even that anticipation anxiety. Do you think, Natanya, where I know that I have to go to this event, I'm not feeling 100%. What if that migraine attack, starts to
mhm,
really escalate, and what am I going to do? And we know that we can elevate our stress levels and almost, not set ourselves up
mhm.
for the best kind of experience that we're going into just with that anxiety. And it's very well known that there is lots of anxiety around migraine, and the unpredictability of attacks and how they're going to impact us in our life. So yeah, thank you. I could listen to Natanya's voice nonstop. It's so relaxing.
Thank
I'll
you.
let you I'll let you go on, Natanya.
So yeah, and I think that thank you for saying that because it's true. That I am going to talk about it later, but there is this picture people seem to have in their mind that it's somehow separate to your life. But if we practice it when we think of it as part of what we're doing, it becomes more natural and easier for our brain to utilize that tool to calm those senses. So it increases our what we call our threshold. So that you know we can we have a wider threshold before the attack starts getting too bad or too whatever. So yeah. Um, So meditation is actually is a formal practice. So where mindfulness is not a formal practice, you can just do it, as you're going about different tasks. Meditation, you actually do need to set aside time to concentrate on your meditation. It's taking up a position for a period of time. It could be 5 minutes, it could be 20 minutes. Some people do it for a lot longer, in which we practice focused awareness of what we sense and experience in the present moment, without judging anything passing through our awareness as good or bad, and not turning the awareness into thoughts. We might start by focusing on the breath without changing it, but simply noticing and focusing on this. Our minds, and then we can move on to other things. Our minds inevitably wander off to other thoughts, but we notice and we bring it back to whatever that focus point is. If it's our breaths, it might be a visual aid, it could be how you feel against the seat, it could be a whole bunch of things. So the action of meditating is actually noticing that thought and escorting it back to what you've chosen to focus on. For me, often it's the breath or a mantra, a specific word, but it depends on what the practice is. So, and this is a formal practice. So, you can't do it while you're driving. or anything like that, because you really need to be very much concentrating on this process or focusing on this process. So, yeah, so that's meditation. Let's go to the next slide. So I wanted to talk though about practical strategies for meditation, because I think we do have this picture of what meditation looks like. And for us who are facilitators of the mindfulness-based chronic pain management course, and who work with people with migraine and other types of pain, it's important that we do whatever is kindest to our body at that time in that moment. And I think it's also something people don't realize, that meditation can take lots of different forms. It's not just the stereotypical image of some woman at the top of a mountain saying Om, she's sitting on the ground with no back support. I don't know how she does that. So you can have walking meditations, you can have moving meditation, you can lie down, you can sit up, your eyes could be open, but at a soft gaze, or you can close them. And then, of course, you can have different areas of focus. It could be part of your body. It can be breath. A lot of people have trouble with breath, actually. It could be a sound, so things you hear outside, or it could be some sort of visual object like a candle or the trees outside, or something like that. The idea is just to be focusing and focusing. Your mind wanders off, you bring it back. So it's pretty simple, but it does take some practice. So and I like to break down this idea of what meditation is supposed to look like, because I think it puts people off. I think if I had that stereotypical image when I was 19 and first learned to meditate, I probably would never have done it, but I had no idea what I was learning. So I think I was lucky in that respect. But yeah, it's versatile, and there's no scientific evidence that you have to be sitting in a certain way, that you have to concentrate on a certain thing or anything like that. These things are not backed up by evidence. So we can actually, I think for me, I find it much more important to be kind to our bodies, particularly people with a neurological condition, often with other conditions, have physical conditions, maybe a lot of people with migraine have things like fibromyalgia and other pain conditions. So it's really important to respect our bodies and support our bodies and what they're asking for at that time. And for me as well, that's actually mindfulness, is to be mindful of what your body is requiring of you in that moment. The other thing is, if you're uncomfortable, so you start a meditation and you get 5 minutes in and you think, oh, my back's really hurting, move. You don't have to stay still the entire time. Is there anything you wanted to add there, Christy?
No, I really love the way you explain it. And I think in contrast to Natania, I did have a lot of those stereotypical kind of misconceptions about meditation, and sort of tried it a few times and thought, I think I'm bad at this. I just can't clear my mind. So that blank canvas of a mind perception is really not at all what it is. And I think Natania is great as, an advocate and a migraine coach, of really getting that sense, like, to listen to your body. There's not a right or a wrong thing. If focusing on the breath is not something that's comfortable, which was something that well into trying it several times was an aha moment for me, that you can just redirect your focus somewhere else. So whether it's kind of a physical sensation, usually for me, it's wherever my hands are kind of positioned or sitting. Yeah, I think that was great. Thank you.
Yeah, excellent. Thank you. Um, and Christy just touched on this now, but there are misconceptions around mindfulness meditation. I love this image that you found, which is like
We did
you're
think that this
rising
was
above,
great. We're
saying
like,
Om,
yeah.
and the kitchen's turning into a complete like chaotic nightmare. But you can meditate and
Yeah,
practice your
you just,
mindfulness through all of that. Yeah, and think about nothing, about what's happening. Totally empty thoughts. It's just not realistic and not what's going to happen. So misconceptions that meditation involves clearing your mind, that it's supposed to be empty of thoughts. Well, that's like stopping the tide. It's your mind is designed to have thoughts. It's fine. It's supposed to have thoughts. Meditation is actually noticing that you're having the thought and bringing it back to where you wanted to focus. That's a muscle that you practice, and you get better and better at it as you go along. I mean, I've had meditations even, I've been meditating for 30 years, and sometimes I come out and go, oh, my mind was full of thoughts that entire whatever, but I wouldn't say to myself, oh, I had a bad meditation. Like that, there's just not such a thing. People view thoughts and emotions as distractions to meditation. Well, as I just said, they're not, they're just part of the process. Meditation is a process, not a destination. There's an implication that migraine is due to stress. So as Christy talked about before, and then that meditation is, you need to meditate to manage your stress, but that's not really how it works. Meditation, practicing regular meditation and mindfulness does help you manage stress. It can help reduce attacks, migraine attacks, or your relationship to your migraine attacks, and that in itself can reduce the impact and the severity of your attacks. There's no, as I said, there's no such thing as bad meditation. There are variable quality and quantity of resources and programs out there, so it's hard to know what to pick for yourself to do. We'll talk a bit more about some of the things that are just online. The other thing is that there's no expectation that once you do mindfulness or you're learning about mindfulness that you have to be mindful all the time. It's just not really realistic. I think it's about taking those mindful moments. It's about bringing yourself back when you notice, when you want to. And I actually think that people who practice these tools slowly, as they practice more and more, it just becomes part of your life to notice what's going on for yourself more regularly. But it's, I'm yet to meet anyone that's, other than maybe like the Dalai Lama or someone where it's like 24 hours a day. Like it's, we're humans. I think we have to recognize that we're just human beings. There's another misconception that mindfulness and meditation is the same thing as relaxation, and it's not. So meditation seems to go through stages of how you respond to meditation and how it feels to meditate. And at the beginning, often, not always, it can feel like, oh, I'm getting into a really relaxed state. And then after doing it for a while, it starts to feel different when you meditate. And then you keep doing it for a while and it feels different again. So it's not the same thing as relaxation. It may lead to more relaxation, but that's actually not the goal. It's not a quick fix, and it does take time and consistency, while most important of all, being kind to yourself and just noticing what's happening. Nothing's right, nothing's wrong. You miss a day, oh well, okay, that's fine. I've got today, so it's fine. So yeah, I think they're key challenges and misconceptions. And I'd be interested, if anyone has any questions, please put it in the chat because we can talk a bit more about that at the end too.
All right, back to
To
me.
you.
So we want to kind of tie these things, all together and talk about mindfulness and the brain and in the context of migraine. And there has been, not even recently, I think for a long time, growing interest in the role of mindfulness and meditation. What does it do to the brain? It's been fairly well studied in areas of pain, and in other areas of mood. And there's some suggestion that it can influence both the structure and the function of the brain. So when we have some of these changes, we refer to this as neuroplasticity. And I think our understanding of, what we can do in the idea of strengthening our brain and building new neural pathways, is something that has kind of evolved in my lifetime for sure. And what really is kind of the outcome of this? So the regular sort of practice of, formal meditation and then daily practices of kind of mindfulness, can influence some of the neurochemicals in your brain. So some of these things are responsible for mood, and, just how we're kind of feeling day to day. It can influence structure, some that are related to memory, emotional regulation. So there's these kind of broad things that happen. Some of the summary statements about what happens is that it can improve some of your psychological flexibility. So this is, a bit of an abstract term, but there are lots of things one goes through when they're dealing and living with a chronic disease. And it can be really challenging to evolve or sort of move towards a place where maybe you have some acceptance of these things, or to mitigate the very real anxiety of it having sort of more control over your life than you have. So you almost feel like you become sort of a passive participant in the disease leading you. And I think that truly the lack of resources that can be out there, including specialized providers and, access to information about migraine, really exacerbates this as well. So, like I said, it can be a very lonely journey, and people are left to try and navigate these things on their own. There is kind of another way to just that it's kind of described is that it reduces some, there's no good way to say this, detrimental habits or reactions. I always feel like this is kind of laden with judgment, but there are things that we all do that are maybe not the best reaction to things. And that can really tip the balance sometimes in somebody who has migraine. We always talk about, there's sort of a threshold maybe where somebody kind of builds up to that and gets sort of triggered into an attack. So anything that we can do in that multifaceted approach that takes a few steps away from that threshold of a migraine attack can be helpful. And mindfulness really plays a great role in this. So, as Natanya had said, we know that we have to practice things fairly regularly to incorporate them into our routine. They become habitual. You can really strengthen this skill set like anything. So I like these images as well. So you're really going to kind of work out your brain, you're going to nourish these mindful habits, and then you do start to see some benefits. And I think the great thing is Natanya and I have witnessed people go through these programs and the stories and the impact that they have shared on their migraine journey, and their lived experience with migraine has been really nice. So she'll share some of those as well. I realize actually this was a very busy picture to put on this slide, but what is the research though? So there's one study I wanted to kind of highlight. It's fairly recent, and it's a hard thing to capture what mindfulness and meditation does for migraine. But in this particular study, they took 89 adults, they randomized them to two groups. In one group, they went through a formal 8-week MBSR, or mindfulness based stress reduction program. So, really giving them the foundation and the tools and philosophy around mindfulness and strategies and practical exercises to work through. And the other group got 8 weeks, just as much time of education related to migraine. So both got the same amount of kind of attention, but very different in information. So what happened? Both groups actually did have some improvement in symptom days. So that was nice. So what the MBSR group showed though was improvements, and they did standardized, validated questionnaires. So migraine related disability improved, quality of life scores improved, depression scores improved, self efficacy. So people's sense and ability to manage their condition or migraine on their own, as opposed to being reliant on external factors or just not feeling like they could manage it. That improved pain catastrophizing. And then what sounds quite medieval, but experimentally induced pain intensity and unpleasantness tolerability improved. So um, I think that this is important because these are the things that allow you to live better, right? The quality of the of life, being able to not have maybe as much anxiety or feeling like you have a plan if a migraine attack develops, even though you have something important going on. So that's what this study showed. We know that it's hard to capture this in research, but we've also seen it in practice. So I'm going to turn it back to Natanya to talk a little bit about some of the resources that are out there. And we're happy to, if anybody has questions about some of the many things that they've encountered related to mindfulness and meditation, maybe we can help you navigate them.
Yeah. So there are practical strategies, obviously. There are apps out there like the Calm app, which I use, the Better Sleep, which I've used in the past, and a number of others that I don't know of, but I know that they're there. And there's YouTube. You can find meditations and exercises on YouTube, and of course, lots of stuff listed on Google. And then there's mindfulness that's parts of other therapies like cognitive behavioral therapy, where it's a part of a more comprehensive therapy that you might do with a psychologist or practitioner. And you may not even realize that that's a mindfulness strategy. And then there's formal courses like the ones Christy and I offer, and the mindfulness-based stress reduction and other formal mindfulness courses. I think for me, they're all useful, and nothing it's silly to go, oh, this is no good and this is better. It's really that the formal courses teach you foundational skills and tools that you can use continually, and really allow you to explore what works for you, what doesn't, how to implement things, how to have you might have those aha moments where you realize, oh, this one thing, like Christy did with her breath, all of a sudden she realized the breath wasn't working for her. Where, the formal courses allow you to work through some of that stuff and to have an experienced facilitator and a trained facilitator to help you work through that and to really embed these practices. And then I think the apps, for me, the apps and YouTube are really complementary. They help you to maintain practice and to practice ongoing, and they might help do a bit of relaxation at different times as well. So I think they're the key practical strategies.
Yeah, and I think, Natanya, to your point before, like about kind of doing what is right for you. I think for anyone that's kind of deriving some benefit from an app, one thing that we did talk about and you mentioned is like that typically those are usually focused on a formal meditation as opposed to integrating the mindfulness piece. And if you are enjoying that, then maybe being open to explore kind of other strategies and other types of resources. So kind of growing maybe your skill and repertoire. And for anyone who's maybe tried these things and thought, this is not for me, then I think this is where you and I, Natanya, were hoping that maybe we could dispel some of the misconception around it and have people revisit and maybe kind of keeping an open mind to how this could fit into their life. Um,
Yeah.
and it's true, like you can kind of come to things and kind of move away from them at different times, but I think probably all of us can agree that we have many, many things that are vying for our attention at all times. There are screens all around us. We're getting inundated with different forms of, messaging and emails and whatnot. And if we have people in our lives that also need us, it is not possible to do all things at the same time. And when one feels like they're maybe getting pushed to their limit, close to migraine attack or otherwise, bringing back some of these strategies and gaining some of that mindfulness can really help to de-escalate that stress response and, take a breath and kind of move on and reprioritize maybe what needs to be done and be kind to ourselves.
Well, yeah, and you're exactly right. So I mean, this is actually a later slide, but I'm going to say it now because Christy brought it up. I recently finished facilitating a mindfulness-based course for people with migraine, and in fact, that type of feedback is exactly what people were saying at the end. It really, it's really helpful for them to be able to practice it ongoing. There's no limit. There's no limit to how often you can practice your mindfulness. When with medication, obviously, you can only have so much. You have to wait so long. You have to wait for so long, between doses. You have to wait for so long for it to be effective, and then it may or may not be that effective, depending on where you're at in your attack. Whereas with mindfulness, you can use it as much as you like, and there's really no negative side effects. So yeah, so I think that's one of the benefits that the formal course teaches you how to utilize that. And this is actually the slide. So yeah, I just co-facilitated with Dr. Jackie Gardner-Nix a chronic pain management, a migraine, my words are slipping, a mindfulness-based chronic pain management group specifically for people with migraine and headache disorder. There were 16 participants with chronic migraine or other forms of headache, and it was an 8-week course. And I just wanted to give you a couple of testimonials that people have given us that we have permission to share. So one participant said, "It's really been life-changing, and I'm so grateful for that. It gave me the sense of accountability. I'm on day 49 of daily meditations, and I've noticed such a big difference in my outlook, even when I do get bad headache episodes. I've had a significant decrease in headaches and nerve pain, which makes my life so much better." So for this particular participant, they found that it really, the daily practice really has had a significant impact on reducing their disability and in increasing their ability to participate in their day-to-day life. And we have had other feedback from participants who, they were basically housebound, and after going through one of these formal courses, they were able to get out and about and start participating more with their family and in social circumstances. So it's a really helpful tool. It is a really helpful tool. And this is the participant who basically Christy was, led me into. Mindfulness is side effect free. This person said you don't need to buy things to practice, that for them it was life-changing, and it's been the best choice that they've made in their wellness care. And that's the important part too. It's just as that earlier slide, the 3 parts, this is just one part, and it doesn't replace anything else. It's a thing you can do yourself ongoing, and help yourself to continually manage your condition.
All right. So, quick summary. So, some of the things we sort of hoped that participants would take away, that mindfulness and meditation are tools in a multifaceted toolkit. We know that there can be a lot of powerlessness involved in something like migraine, especially if you are trying to navigate a system get a diagnosis, get to a provider that can manage you. There's just a lot, there are enough things that are out of your control that can really complicate things. So tools like these can really build that self-efficacy and individual capacity to help manage migraine. You don't need to, as Natanya said, wait for another dose. You don't need to wait for another appointment. You can utilize these things. Clearing your mind. So I for sure was all the stereotype misconception. So this idea of clearing your mind is not the goal or even possible. There isn't sort of a good, a bad meditation. You will have days where you are just you maybe don't even notice that you're not thinking about anything because you're so unfocused. And then over time, it may really surprise you how long and how able you are to kind of tune into the things around you. And it's a really good sense. Like I don't know how to describe it, but it is a really, really good feeling. Um, you can, as we kind of said, there's a sense of sort of increased control back in the individual that's living with migraine. And this was certainly what a lot of the participants to Natanya's program had said. Aside from just some of these anecdotal things, it's great that there is kind of growing evidence that show reported improvements in quality of life, reducing depression, increasing tolerance to discomfort, and and then there's a blank there. So, and fill in the blank, all the good things. But a lot of really important things that I think ultimately I always talk about, it's not about curing, it's about living well and not letting kind of migraine live your life for you. So it really does, I think, lend itself well. It's one more kind of tool in your toolkit. And it can help improve some response to medical intervention. So there's talk about too, when I listed that slide with all of those different symptoms at different times, I've had patients talk about how, oh, they're able to kind of tune in maybe to some early signs of a migraine attack. Maybe they're able to treat a little bit sooner because they have a little uh, improved awareness around some of those symptoms. And if you can reduce yourself away from that threshold, then maybe you can spare yourself some days of acute medication use as well. So there's lots of different potential outcomes.